I'm Jan Wyatt. I'm a retired nurse practitioner, a former Navy nurse. I have 3 beautiful daughters. I love to garden and golf, and I'm able to do this even though I have rheumatoid arthritis and osteoarthritis too. The symptoms of my RA really started about 12 years ago. I would get pains in my wrist and fingers and elbow and knees. My feet and ankles were probably the worst. From the time I was diagnosed with rheumatoid arthritis till I really felt good about my therapy and felt good about daily activities and quality of life was really about 4 years. I have a wonderful rheumatologist. She and I have been involved for probably 7 years. We tried a lot of different therapies during that period of time, different combinations. A couple years ago, I had a very negative reaction to a biologic drug, and she was critical to making sure that communication and the plan of care that was worked through that process was appropriate for me. I take probably 12 different pills every day. I am so used to the balance of the medications that I'm taking. I monitor them very carefully. If my therapy was disrupted, I know that I would begin to experience more pain. I cannot really understand any reason to switch my medical treatment unless I'm not getting the right response from the drug, which my rheumatologist and I would really carefully monitor for. So I think that policymakers and insurance companies are trying to find a less expensive therapy. And that can be beneficial for some people, but it's important that people don't switch a medication when you're on a stable plan of care to another treatment that might be somehow just less expensive. If there's a policy in place that allows switching to occur without my knowledge or without the knowledge of my physician, then that would really be frightening and a threat to safe quality care. We as patients do not want to be switched. One of the most important things that patients can do to advocate for themselves is to make sure policymakers and legislators understand the importance of the patient-provider relationship. A disruption in therapy would really be particularly problematic for me. I have 2 weddings coming up this next year. My 2 daughters are getting married, and I'm looking forward to dancing at those weddings. I don't dance very well, but if my feet are hurting and my ankles are swollen and I'm in pain, that's going to be really a problem for me. I'll be crying, but I'd rather be crying from joy than crying from the pain in my feet.